Hi.
Hello.
How did your elective hip replacement go?
It went well.
I'm glad to hear. It seems that your lungs are clear. Your incision site is clean and dry. You do have some help ambling to the bathroom. It says that you can't fully do it yourself, right?
Yes.
And you're wanting to return home
Yes,
independently?
definitely.
Okay. So to help this, we're gonna discharge you to a subacute rehab, and they'll help you there to gain strength to do stuff on your own. Also, your son lives close, so he can really help you with your cares when you return back home.
Yes.
On your chart, I see that you had a hypotensive crisis while in surgery, so they had to give blood.
Yeah.
And then you have a past history of osteoarthritis, breast cancer, hypertension, chronic AFib. Do you have any questions about those?
The AFib I do. I've had it for a while, but I'm just wondering if you can just help me understand a little more, but then give me how it's going to look now with this new complication that I've had.
Yeah, so AFib is when your heart isn't able to really fully pump out the blood, so there's kind of like stenosis in your heart, which can lead to clotting problems.
Okay.
So you can have like a thrombosis, like little clots. And because of your risk for clotting, we're going to put you on Lovenox, which is an anticoagulant, and warfarin. But these lead you for a bleeding risk, and you just had hip replacement, so we might just hold off for a little bit before giving you those. We'll talk to your doctor to make sure that's what our plan is. We're going to put you on for ferrous sulfate, which will help with your iron deficiency because you lost a bunch of blood during surgery. And then because you have a history of hypertension, we will be giving you lisinopril to help with your hypertension. Like I said, you're going to go to a subacute rehab. Do not shower for 3 days post-op, so wait to do that. Just freshen up with a wash-up will help. Or your son can help you with that. Leave dressing on until 7 days post-op, and then leave open to air. And if you do take your dressing off, just examine the site, see if there's any of the stitches that came out, or you see any redness, swelling, pain, just notify us. Follow up in 2 weeks, so we'll set your appointment up for that. And weight bearing as tolerated says that you have trouble ambulating to the bathroom. Just take your time with your walker. Don't go fast. It can lead to more complications and could fall. Just take your time. And then you can have a general diet now that you're done with surgery. You can eat whatever you'd like. So,
all right. Well,
one thing though, since you have hypertension, try to reduce your salt intake. So limit your salt on foods. You can do different spices to add flavor. Try not to eat fast food. So, do you have any questions?
I think you've covered everything.
Alrighty, if you have any questions, just let me know.
Okay, thank you.